Anxiety among age groups. Presenter, Maddie Pearl. Image description. A large pile of tan Scrabble letters lying on a table with 7 of the tiles spelling out the word anxiety. Overview. Key ideas. What is anxiety? Who experiences anxiety? How do different age groups view anxiety? How does anxiety differ among age groups? Signs and symptoms among age groups. Tips and tricks for anxiety, and my personal experience with anxiety. Image description. A silver animated key pointed slightly upward. What is anxiety? Dictionary definition: a feeling of worry, nervousness, or unease, typically about an imminent event or something with an uncertain outcome. Image description: a middle-aged woman with dark brown hair and a gray and maroon sweater on scrunches her eyes and nose in anguish while running her fingers in her hair. What does anxiety feel like? YouTube video. Attached I have a video that explains what anxiety feels like to different people. Watch up until 1 minute and 15 seconds to see how it is described differently. Who experiences anxiety? Number 1, children. Image description: a young boy in a blue and red plaid shirt grips tightly around his mother's waist who is wearing denim jeans and a yellow sweater. Number 2, teens/adolescents. Image description: a teenage woman with blue denim jeans on and a black hooded sweatshirt sits on a set of stairs with her palm in her face. Number 3, adults/elderly. Image description: an older woman with white hair, tan pants, and a pink and gray sweater sits on a cream-colored couch with her hands holding her head. Overall, people of all ages experience anxiety. It is not something that only affects a certain age group. How do older generations view anxiety? Back in the 1950s, mental illness in general was very stigmatized and had a lot of fear surrounding it. People with mental health problems were seen lunatics and sent away to asylums. Older people were less educated about mental illness in their younger ages, so they continue to stigmatize it. These people tend to have negative attitudes toward mental health since it has been seen as something so horrendous back in the day. Many people back in the day were told to not express emotional suffering and that they just needed to be fixed, which led to their opinions on mental illness. Image description: a group of 3 older men and 3 older women smiling into the camera. Image description: a cartoon image with a blue background that shows an angry older man with white hair reading a newspaper about millennials with a group of people protesting behind him. How do current generations view anxiety? Younger generations are more accepting of mental health than past generations. People in my generation, born around 1990 to 2000, are much more vocal about mental health. This includes admitting to mental health disorders, talking about going to therapy, taking medications, etc. This generation is more apt to making there be less of a stigma around mental health and trying to help other people with their mental health problems. Millennials grew up hearing about mental illness, including anxiety, and so they are more accepting of others with mental illnesses and not afraid to speak up about it. Image description: 2 young boys with brown hair and 1 young girl with pink hair sit on a couch and smile as they hold video game controllers out in front of them. Signs and symptoms of anxiety in children. Being very clingy. Children may have a hard time expressing their feelings, especially one that is hard to explain like anxiety, so one mechanism they tend to have is to cling to their parents. Complaining of tummy aches and not feeling well. In this young age, children do not understand what anxiety is, so they complain of the physical symptoms that they are able to feel and explain. Not able to sleep/wetting the bed. Many kids who deal with anxiety find it quite difficult to sleep. This may be because they don't feel well, they are scared to be without their parents, etc. Not eating properly. Children may find it hard to eat because of their constant tummy aches. In reality, they are most likely experiencing anxiety, and this is a sign to look out for. Image description: 4 very young children smile as they peek over the top of a white wall. Signs and symptoms of anxiety in teens/adolescents. Performance dip in school. One of the many telltale signs that a teen suffers from anxiety is their dip in school performance, especially if the teen is usually someone who succeeds fairly well in this area. Loss of interest in past activities. As a teen becomes more anxious, they may start to stop involving themselves in the activities and hobbies that they used to enjoy doing. Trouble sleeping or always worn down. Just like in children, teens with anxiety find it hard to fall asleep, stay asleep, or are constantly tired. Anxiety takes a toll on the body. Loss of appetite. Teens experience the physical symptoms as well, such as stomach irritation, which makes it hard for them to want to eat. Signs and symptoms of anxiety in adults/elderly. Behavioral. Difficulty making decisions. Avoiding situations that cause anxiety. Tendency to be startled easily. Not being assertive and avoiding eye contact. Physical symptoms. Muscle tension and pain, hot and cold flashes, sweating and shaking, stomach pain and nausea, increased heart rate. Thoughts and feelings. I'm going crazy. Overwhelmed. I'm about to die. Constantly tense or nervous. I can't control myself. An uncontrollable panic. Treatments and tips and tricks to help with anxiety. There are many different kinds of therapies that can help with anxiety symptoms. Supportive and interpersonal therapies, acceptance commitment therapy, cognitive behavioral therapy. The goal of therapy is to help patients change their relationship with their symptoms, help people understand the nature of anxiety, and help people be less afraid of the presence of anxiety in their life. The lemon trick. Eric Zink, someone who has suffered from anxiety for many years, swears that biting into a lemon while having an anxiety attack is an amazing grounding technique. He explains that the texture and bitterness of the lemon is going to make you focus more on your mouth than what made the attack happen. A young woman in her 20s posted a thread on Twitter of what helps her get out of her anxiety attacks or slow them down. Temperature is a huge thing. Getting the person something cold helps cool down the rest of the body and stops the sweats. Offer them something to hold, such as your hand, a water bottle, etc. The body will feel more grounded holding something physical. Sometimes music helps calm people down, so ask them if they would like to listen to some. Lastly, ask them if they want to talk or be in silence. Anxiety attacks are different for everyone, and people want different things. In-class sources. Tracy Clayton, when taking anxiety medication is a revolutionary act. We read this article back in week 7, and I was able to relate it to this artifact very well. Anxiety can be exhausting physically as it is mentally. The tears that come from nowhere, the knotted stomach, the squeezing in the chest, the muscles that feel like they'll snap if they get any tauter. With the help of a tiny white pill, I wake up in a better mood, I am calmer and more focused. This quote shows how drastically your life can change when you are given the proper treatment for your diagnosis. Margaret Price, Defining Mental Disability. This article was also one that we came across in week 7 when talking about neurodiversity. This article talked about how mental illness was seen as a problem in the medical world and for insurance companies. Image description. A young girl with dark hair and a pink hooded sweatshirt across from another woman on the couch who wears a white shirt and brown glasses. My personal experience with anxiety. I was always an anxious kid, but never went to the doctor for it. I saw my school counselors throughout the years and learned breathing techniques. As I got older, especially once I hit college, I noticed my anxiety getting severely worse. I would have panic attacks randomly, found myself not eating multiple meals a day, leave class and cry, and I was not hanging out with as many people as normal. I was having constant stomach pains. Finally, I decided to do something about it, and over this summer, going into my sophomore year of college, I went and talked to my doctor. She prescribed me anxiety medications. I had to switch up my doses for almost 2 months until finally it made a difference. My main point here is to emphasize that this is normal and it is okay to not want to get help or fix yourself right away. It takes time to come to terms with something like this, but it has made a lifetime of a difference for me and many others in the same boat. Image description. 4 20-year-old women with their hair pulled back with white and gray clay face masks that cover the entirety of their face. Resources.